Hello and welcome to Global Health Conversation. I'm your host Sonam from Nepal with a passion for rural healthcare systems. Today we have a special guest, Mr. Carlos, Director of Hands of Mercy Buwaya in Uganda. They are doing incredible work in rural healthcare on the Buwaya Peninsula. Welcome to the show, Mr. Carlos.
Thank you so much, Mr. Sonam. It's really a great pleasure being here to talk about our work in Uganda.
Carlos, I'm fascinated by rural healthcare, especially in low resource setting. What inspired you to establish Hands of Mercy Buwaya?
It all began by looking at the challenges in our community. There is a great disparity in healthcare access, mostly for the basic healthcare. There is a challenge of transportation. There is access problem for the healthcare facilities, not only in my community, but mostly in all the rural communities of the country. People really suffer mostly from preventable illnesses. If you can look at HIV, malaria, these are really preventable, but really they take over people's lives. So all these challenges really motivated me to get on the rail and start really helping the communities and coming up with the idea of Hands of Mercy Buwaya initiative.
That's amazing. In Nepal, we face similar challenges. People often live far from clinics and rely on informal care. Okay, what do you see as the biggest healthcare challenges in rural Uganda?
The biggest challenges are number one, I can say healthcare facilities are limited. And secondly, I can say that people, of course, lack resources to reach these places. And in fact, if they reach the healthcare facility, there might be a challenge in that they might fail to find a trained healthcare worker. They might not get the equipment really needed to treat their illness. So combine these are really major challenges, I believe, back in Uganda, which are really, affecting people in terms of healthcare access.
Well, that was amazing, Mr. Carlos. It's very interesting to listen all your story and your initiative. It sounds quite similar to rural Nepal. How are you addressing these issues through Hands of Mercy Buwaya?
Firstly, we came up with an initiative of setting up a healthcare facility, which is minor. It's providing emergency healthcare services, which we can say first aid. And we are doing health education. And on the top of that, really, we are training village health workers. Combining all these, it's like we're empowering our community to come together and acknowledge the challenges they're having. And in due course, we are able to solve the challenges which are apparently in the country village.
Education is key, I agree. How do you ensure the local community engages with these health education efforts, sometimes in rural areas? There's resistance or lack of trust in formal healthcare.
Sonam, thank you for that question. Usually, we engage with village health workers and the community leaders. These are people who have developed a very good trust in the communities. So, by engaging them, it's like we're able to bring all the people on the platform. And secondly, we're doing open forums where we're inviting people to ask questions regarding health, and we're able really to share with them the knowledge. And by doing that, really, we have been able to develop a good trust in terms of, giving health education to the community.
That's great to hear. Building trust from within the community is so important. What's your vision for the future of Hands of Mercy Buwaya? What do you see it going in next few years?
Actually, Mr. Sonam, our long-term goal is to set up a permanent healthcare facility which will really accommodate a maternal health care center, a small pharmacy, because we have observed these are among the major areas where really people are still lying back. Mothers struggle, giving birth, attending antenatal because of the distance. So our long-term goal is really to set up a permanent health care and also to continue with the health education because we believe that if people really have knowledge, they are able to take power of their health. Thank you.
Well, Mr. Carlos, that's a powerful vision. Rural healthcare is such a crucial part of building healthy, sustainable communities. As we wrap up, what message would you like to share with anyone listening, whether they are in Uganda, Nepal, or elsewhere in the world, about the rural healthcare system?
Thank you, Mr. Sonam. It's been a pleasure joining you up to share about our journey regarding healthcare uh, and healthcare in our communities of Uganda. Thank you very much. I hope to be invited again to be with you. Pleasure.